Nicole.
And we're from Goodyear Chiropractic Health Center, and we're doing our joint-by-joint approach. We're doing it on the cervical spine this week. Last week we did it on the shoulder. As far as cervical spine conditions, you can have just mechanical cervical or neck pain, and usually that's just localized pain along the neck. It can be at the lower part of the neck or the upper part of the neck, whether it's upper cervical or lower cervical. You can have headaches associated with cervical pain. Typically, upper cervical issues have more propensity towards headaches than lower cervical conditions. You also could have postural related tension or pain in the shoulders or neck region. People that sit at desks all day are protruded with their head, and their shoulders are typically rounded forward, so they can have just muscular tension in their upper traps or in between their shoulder blades. You can also have conditions that are termed in medical terms disc herniations or cervical radiculopathies, and those are people who have pain not only local to the neck but that travel down their arm. So they have nerve root symptoms down the arm that can actually inhibit their ability to reach or use their arm, and they can actually have weakness if it progresses. In order to determine what's causing the patient's issue, we can utilize imaging, X-ray or MRI, and we also get a detailed history with a thorough examination. So we're going to go through the examination process. Typically, we would check range of motion, or not range of motion, we would check muscle strength, and then we check range of motion. So we're going to do range of motion for the cervical spine. I'm not going to check muscle strength because with her, she's not going to have any deficits, and that would be for somebody who would have nerve root symptoms down their arm. So as far as range of motion, I'm going to have her protrude her head forward and ask if she's getting an increase of pain or if she has any symptoms with that.
No.
I'm going to have her retract her chin backwards. Good.
No pain.
My head forwards. So when I'm
No pain.
looking at this, for someone her age, I'm looking to see if there's any deficits or an increase in symptoms while she's doing these movements. Good. Rotate to the left. Good. Rotate to the right. Good. I'm looking if we're going left or right, any discrepancies in range of motion. Sometimes historical information, they have difficulty looking over their shoulder to look while they're driving, stuff like that. And the other side. And with some lower cervical conditions, sometimes there's a loss of thoracic or upper back motion, so I'm also going to look at that to see if there's any pain or discrepancy with that. Good. Good. Perfect. If she were to have nerve root symptoms down the arm, what we're going to be looking at in our mechanical assessment is there any movements, positions that we can do with the mechanics of the cervical spine to centralize or alleviate the nerve symptoms. In about 60% of cases we can find. Also do fascial stretching or ART or anything to release any neural tension if the patient is having tension reaching with their arm with the cervical spine condition. So all that we're going to gather, all this information we're going to gather through a detailed history assessment and any medical imaging that we might need, and we're going to utilize our team to provide that. So thank you.
Thank you.